The following podcast is by Dr. Shawn Weiss, President of Senior Health and Wellness Group on the Answers for Elders Radio Network. And welcome everyone to Answers for Elders Radio. And we are here with a very important hour this week. And because we have a brand new guest and someone that I have been very connected to for like over 10 years now, which is absolutely incredible. And she's one of my favorite people. And she's in the state of Ohio. And that's one of the great things about us being on a national podcast network is that we get to bring to you some of our national experts that are so incredible in what they do. And today we have Dr. Shawn Weiss, who is a licensed physical therapist and founder of the Senior Health and Wellness Group. And, you know, I don't think we've ever really talked much about senior health and wellness. And we've got some really powerful topics for you this hour, including at the end of this hour, we're going to give you kind of an update on the Delta, variant of COVID and where we're at with that. And so without further ado, Shawn, welcome to Answers for Elders Radio. So glad you're here.
Oh, thanks, Suzanne. It's great talking with you. I'm so excited to be able to talk with you for the next hour.
Well, we're happy not only that you're going to be part of our hour, but you're going to be one of our absolute specialists on the website. And of course, you're going to be reachable on all of our podcast platforms across the country. And we're going to talk about different topics today, Shawn. And I am so thrilled that we're going to be talking about some of these, issues that so many families are dealing with. And of course, for you, just before we start, would you give us a little bit of background of what does the Senior Wellness, Health and Wellness Network do?
Well, I've been in the home care agency ownership phase for about 18 years now. I have also been a practicing physical therapist for 23 years. And during that whole time spanning caring for older adults, in all different sectors and disease processes. And when I started Senior Health and Wellness Group in 2019, it was really out of the need for more education for families, training for caregivers that we have seen in the home health field. It's just a real necessity, and it continues to be. So this allows me to have a platform where I can take our expertise, even expertise of some colleagues, and make sure that we are providing quality information to older adults, to the families of older adults, and to the caregivers of older adults.
Absolutely. And Shawn, it's interesting that you say that, because how many times do families think, oh, mom or dad are just fine, but they're still at home, but there might be certain factors that they don't even realize might be going on in a home. And it doesn't mean that mom and dad can't still live at home independently, because that's something obviously we all want to have happen as long as possible. But there's other, red flags in the home that if these things were, a family was aware or the senior was aware, we could prevent accidents from happening. And I know that for the first segment today, I would love to talk to you about, what does summer, the season of summer, what does that actually, why is that so important? Because obviously it's warmer weather, we don't have ice, but there's other factors, aren't there?
Right, exactly. And we hear a lot about winter safety, campaigns that are happening every winter, but sometimes summer safety is neglected. And I think this summer is so important of any summer to discuss summer safety with our seniors. And
so much so.
You deal with temperature extremes, hydration in the winter also, but when the temperatures get above 80 degrees, we really have to start being careful, because our older adults are so much more susceptible to heat-related illnesses and injuries, really. And because of the summer, it's kind of this summer we're taking it as almost an anomaly over the last year and a half. What have we dealt with? And we have older adults now that may be venturing out and have had a significant period of isolation, decreased activity levels, so their overall medical stability might not be what it should be. And couple that with the heat and extreme conditions, it really creates an environment where there's a high risk.
Well, and I also think too that summer brings about exhaustion more quickly with a senior, because they might be hanging with their family reunion, or, at their son or daughter's house. And all of a sudden they get
Mhm.
very tired quickly due to a lot of these factors. And, are they hydrating appropriately? How are
Yep.
ways that we need to, and not to mention sun damage. It can be very difficult
Right.
for a senior's skin. And so that's even another part of it. Is that,
Yeah, that's what we're seeing.
yeah.
And when you take an older adult and you put them in these situations, you're looking at a few different factors, really.
Mhm.
Um, as we age, our bodies do not regulate heat in the same way.
True.
um, Older adults have much more difficulty with that,
Mhm.
because we don't, I say I hit 50 and somehow I'm going to
I just turned 65,
typically
so
we're
I'm there
talking
now.
65 and older. Okay, so you're included, Suzanne.
And I see my crepey skin and I go, "Oh
But
my God."
I do feel these things as well. That
Of course
um,
you do.
generally speaking, 65 and older,
Mhm.
our bodies do not, we don't sweat as often,
No,
as or as efficiently as a younger adult.
no.
So, and we know that sweat, and sweating is the number one way our body regulates heat. So
Mhm.
that's one concern. The second concern would be, as we age, our bodies store fat differently as well. And when we store fat differently, that also affects temperature regulation and heat regulation. And then you also couple that with the fact that older adults tend to take more medications. And some of
Yeah.
those medications cause an increased
Yeah.
sensitivity to the sun.
Yeah.
So the fact that older adults in general just do not regulate their body heat as well as a younger adult
Mhm.
makes them, even more susceptible to those heat related illnesses. And like I
Mhm.
said, with, the pandemic and changes in how much people are going out. And right now, you feel it everywhere you go. It's just, I think there's a pent up need. People want to be out. And then, like I said, we'll probably talk, in these segments about some of the changes with the
Mhm.
Delta variant that's going
Right.
on, and this is the fear. But in general, when you've seen more people start getting out, and taking their loved ones out
Yeah.
places,
It's
and
kind of a mixed bag, I think, because
Mhm.
a lot of seniors, they want to go out, but they're also fearful and they don't know who
Yep,
to trust. And so
exactly.
there's feeling of, who do I listen to? And the other side of it is, they're, in many cases, they're embarrassed by, maybe their home has been, neglected over the last 15 months of quarantine. They've been in a such situation where they might be dealing with depression, which leads to escalated symptoms of Alzheimer's and dementia. So
Right.
those can, they can kind of be protective, I would imagine, with their family, that the family may not be getting the whole story. Are you finding that the case?
Absolutely. And we find that, with the home care situation, whether we're in
Mhm.
people's homes or assisted living, we worry more about the people that are living alone, and do with have family
Yeah.
members that are checking on them regularly, because you're right, they tell good stories sometimes,
Oh, they sure
and they're
do.
terrified. For 23 years, we advocate, people aging in place. We
Mhm.
want them to be safe and functioning at their highest
Absolutely.
level in their home,
Absolutely.
but sometimes they get really scared. They don't want to admit to sons and daughters and granddaughters and grandsons that maybe things aren't quite as good as they want it
Right.
to be. So they kind
Right.
of paint a rosy picture that may not always be the case.
Mhm.
That's for sure. Yeah.
Mhm. Yeah. And I think too, Shawn, when you look at the whole picture of where we're at with this whole um, situation, and with this summer, I mean, of course, here in the West Coast, we're dealing with wildfires like crazy. And
Hmm.
there's, smoke, which is a whole other piece of it.
Yep.
Where we're at. I walked out on my patio and I looked up at the sun and I saw this orange ball because the sky is full of smoke. Right
Right.
now, we're lucky on Western Washington. The jet stream goes from the Pacific Ocean eastward, so we're not getting the smoke, in our
Hmm.
lungs as much, but we see it in the sky.
Well,
And
we're seeing it out
obviously,
here
I
too.
was going to say,
The
you're
haze.
probably
Hmm.
getting it in,
Yes.
in the Midwest,
Yeah,
because
we were
that
in
is,
Lake Erie over the
yeah.
weekend and we saw it, and the haze, we've seen reports out of New York City that the haze, and we've seen pictures over the last
Mhm.
couple of weeks.
Yeah.
So certainly it's affecting the whole country as that's moved east, and you definitely see it in the sky, and you have to worry about our older adults who have respiratory illnesses, chronic diseases
Oh, yeah.
of getting there. So that's, a whole other, piece of the puzzle that,
Mhm.
you have to worry about.
Yeah.
But in general, there really are universal things
Right.
in the summer when you're dealing with people. And like you mentioned before, the people that are by themselves, who we really need to be concerned about. We need to be
Yeah.
checking on them every
Yeah.
day, whether it's a family member, a neighbor, a
Mhm.
friend. It's just so critical that we are keeping tabs on them. And then, okay, well, let's say you make connection. Then how do we assess
Mhm.
if they are safe? What are the things
Mhm.
that we can promote?
Right.
Certainly we hear about hydration as the number one thing that we do,
Mhm.
eight glasses of water a day. I think there's not anybody that hasn't heard that before. But knowing the warning signs of dehydration, it's one
How
thing to
many
say
of
you
us
need to be
really do it though?
hydrated.
You're right. How
Exactly.
many of I'm guilty. I don't drink
Mhm.
enough water. But,
Right.
and I think that's something that we all need to be mindful of. I think also, for to reach out to our communities and if to our listeners, it's like if you know of a senior in your neighborhood or even a senior community or anything like that that you can just reach out and maybe it's just to say we made some lemonade and here I wanted to bring you a glass or it's
Yep.
something like that. I know that when I used to go visit my mom, every single time I'd go
Mm.
visit her, I would bring her in the summer a root beer float and we'd share that together. And it was
Right.
like this big deal because seniors love sweets. Well, you know
Right.
what? Let them have stuff like that. That's a great
Yes.
treat. And it's a wonderful way to break the ice. So I know that that's so important.
Yeah, it really is important. And we'll have our caregivers even or ask family members to take, the big, like one big 32-ounce jug. And we
Yeah.
say, you fill that up and we want you drinking 2 of those a day. Something that's very concrete, easy to measure, easy to remember is setting it up that way so you can really monitor. And then knowing the signs of dehydration, if you're looking at somebody and you're seeing that their, increased confusion is a sign, rapid heart rate, weakness, all of those things, muscle cramps, all of those symptoms are important to look for in somebody that's dehydrated. Because there's something that can put you in the hospital quicker than anything, in an older adult is dehydration. It is that severe. So you have to know what to look out for,
Mhm.
not just to promote hydration. So
Shawn, thank you so much. And everyone, she is going to be with us this hour. And we're going to talk a little bit now. We're going to go to the other side of the fence and we're going to talk about family caregivers. What's
yep.
going on with family caregivers right now? As Shawn will be right back right after this. We would like to thank you for listening to this podcast by Dr. Shawn Weiss, CEO of Senior Health and Wellness Group, focusing on wellness and prevention strategies for seniors. As a fall prevention specialist, Dr. Weiss provides family support and education to keep your loved ones safe. You can learn more by visiting her website at www.seniorhealthandwellness.org.